MRD has been shown to be a prognostic value when measured after 2 cycles of chemotherapy in AML patients. And actually, therefore, within the 132 trial, we decided to guide the treatment, the consolidation treatment, based on the MRD status for the ELN intermediate risk patients, meaning that the negative patients, MRD-negative patients, would receive an autologous stem cell transplantation, and MRD-positive patients would go to allogeneic stem cell transplantation. And we saw that there was no relapse-free survival difference between these two groups, but of course this was not randomized, so the exact effect remained a question, and we didn't know how to really get to the bottom of what the effect was. And therefore we did this propensity score matching analysis, where we create a cohort which we can match based on baseline characteristics associated with survival, to have an unguided group which matches the guided group, so we can look if there are still if there is any difference in event-free or overall survival. And fortunately, I would say, we saw that there is no difference between these two groups, meaning that the guided group did receive less toxic treatment, autologous stem cell transplantation, but still had the same survival rates. I think what's really different from this study is that we used to get all intermediate risk patients to allogeneic stem cell transplantation, and now we shift to only the MRD positive patients. And this means that for MRD negative patients we can give a reduced intensity treatment, so the autologous stem cell transplantation, and this does not affect survival in a negative way. And we even saw that if these patients would unfortunately have a relapse, then we could still give get them back in remission, and then give an allogeneic stem cell transplantation afterwards. And actually, this allogeneic stem cell transplantation in second CR is also associated with a good survival. I think that there needs to be more data about what to do with measuring MRD. So when a patient is MRD positive, should you then give additional treatment, try to bring them to negative and then go to transplant, or should you just proceed to transplant? And I think until now there's no definitive data saying to do A or B, but we hope to get more data on this. It's really crucial that if you measure MRD, that it is in a standardized way. Within the European Leukemia Net, the ELN, we try to make guidelines and to really standardize and harmonize MRD measuring. This is both for flow cytometry, but also for instance, qPCR on NPM1. And we try to work together, see how we can standardize things, and actually we published this publication about standardization of all the technical requirements for flow cytometry MRD. And we saw that if we would apply these same rules, that we could get similar results in different centers across Europe. But this is really crucial when you use MRD, especially of course if you want to guide treatment on MRD.